Let's move on to On Point. This is the part in the program where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. What else could be more in the spotlight than COVID-19, unfortunately? South Korea's new daily COVID-19 cases remained under 6,000 for the second straight day Sunday due to fewer people taking tests on Christmas Day. And as we just heard from our Han Sang-woo there, we are expecting around 4,000 today, so quite a decline. However, the number of critical cases remains worryingly high. South Korean health authorities say the number of critically ill edged down a touch on Sunday, but the number is still close to 1,100. The number of Omicron cases now slightly over 375, but it must be said that this new variant has been spreading much more slower in South Korea than it has been doing in other countries.
For more on this, we connect to Dr. Alice Tan, internist at MizMedi Women's Hospital in Seoul. Good morning, Dr. Tan.
Good morning.
So let's start with the critically ill patients. The government has been ordering patients out of ICUs as hospitals face a severe shortage of beds. Now, considering some patients are not well enough to be moved on day 20 and some have since died, are there alternative ways that wouldn't require patients to arbitrarily move after 20 days?
Well, thank you for asking this very important question. And I think this really indicates how severe the COVID situation is in Korea. Basically, we've had to shift our paradigm towards critical care from one of first come, first serve to now we are triaging our patients to try to get maximal benefit of limited resources. In fact, in Italy, they've had discussions about this situation since the early stages of the pandemic, when they had a surge of cases that caused some of their healthcare systems to collapse. And as a result, in the entire country, they've had an open debate and discussion about this issue, and they came up with some guidelines that were published in January of 2021 regarding how to triage critical care for patients who need an ICU space when space is limited. And basically their criteria depended on, of course, the patient's overall condition and how severely ill they were, also the number of comorbidities and the type of comorbidities that the patient had, the patient's pre-illness functional status. Importantly, they also considered whether or not the patient had something called an advance directive or had expressed wishes about how they wanted their medical care to be conducted if they were in a situation where they were on a respirator, for example. And then, of course, we also considered in Italy the impact of intensive care and whether or not it was futile or would be helpful, beneficial for the patient. And once these guidelines were published, I think it set a pretty good framework for which ICU directors could think about where they should place their patients. I think in Korea, the Korean Society for Critical Care Medicine, they have initiated this type of discussion. But so far in Korea, we have not published any similar guidelines, and I think it is overdue.
Right, so basically what you're suggesting, maybe take a leaf out of Italy's book, because it seems kind of nonsensical to me that a patient who might be in an ICU for 15 days but has gotten much better, whereas a patient who's been in ICU for 20 days but is still seriously ill has to move. But moving on to our next question. The Prime Minister here has reportedly committed to securing an additional 10,000 hospital beds, these for patients with moderate to serious symptoms but not critically ill by the middle of next month. Now, if this wasn't an option all along, if this was an option all along, why wasn't it done earlier? And couldn't more ICU beds also be brought in? I know there is an issue with understaffed hospitals as well.
I'm not exactly sure where this number 10,000 is coming from. It sounds more like magical or wishful thinking rather than based on any reality of actual hospital bed space and the number of personnel that are available to adequately take care of 10,000 more patients. Um, I mean, this raises a very important point, though. Obviously, we do need to prepare for an imminent surge of COVID patients due to the Omicron variant. Uh, but I will say that since 2015, so that's almost 7 years now, in Korea have been asking for a freestanding infectious disease specialty hospital to take care of patients with highly communicable diseases, which is what we have going on right now. And if we had heeded these requests 7 years ago or even 2 years ago at the beginning of the pandemic, we wouldn't be in quite the situation that we are in now. We do need to prepare more beds, more bed space, but 10,000 seems a little bit unrealistic to me, even though the need is there.
And also, Dr. Tan, given the recent surge, social distancing measures were introduced that last until at least January 2nd. No more than 4 people can gather, and restaurants, cafes, and bars are forced to close by 9 p.m. Given we haven't seen much of a change and small business owners' livelihoods are on the line, should the government consider lifting the restrictions, or do you foresee them being extended again?
There are two currencies that we're dealing with in the pandemic right now. The first is an economic impact, of course. So it's money, it's businesses, it's livelihoods. But the second currency is in actual human lives. Since we embarked on this stepwise return to normal, November 1st, there have been more than 2,300 COVID-19 deaths in our country. And so we need to have an open, honest discussion about what to expect if we do decrease restrictions. I don't think the public was, made aware of what the situation would be when we started the program on November 1st. So I think it's time that we have a realistic expectation about what will happen and have a discussion. But from my point of view, given the imminent surge of cases due to Omicron and also the saturation of medical resources that we have right now, I don't think that it will be safe for our country to ease restrictions further. In fact, I think it would be wiser to tighten restrictions so that we don't have such a burden on our healthcare systems.
And finally, Doctor, we are unfortunately running out of time, but Omicron has yet to make itself really known here in South Korea. It's completely spread across numerous other countries. Why do you think this is the case in South Korea?
I think this is entirely a matter of underdetection and underreporting. So in Korea, we only report confirmed and epidemiologically probable cases. We don't report all of the cases which have PCR S gene target failure defects. Right now, if we calculate both the epidemiological probable and confirmed cases, that's over 500. It's actually 553 as of yesterday. Once we start running the PCR tests that detect the Omicron variant from the get-go, and I think we're starting on Thursday, we will start to see a significant rise in the number of reported cases. So I think everyone needs to know we have many more cases under the radar. It's not that we have Omicron under control. It's just a matter of underdetection.
All right, Dr. Tan, as always, we're grateful for your insights. Thank you so much for joining us.
Thank you.